Good evening, Chestermere. Today is April 8th. Yesterday, Premier Kennedy gave a televised update outlining some of the potential scenarios for the coming weeks. Today, he gave more details about the modeling predicted by Alberta Health Services. In a probable scenario, Alberta Health Services is predicting that up to 800,000 people will be infected and up to 3,100 people will die in our province as a result of COVID-19. That is not an optimistic model. That is a likely scenario. After the Premier's update last night, I had the opportunity to participate in a telephone town hall with Dr. Hinshaw, the Minister of Municipal Affairs, and other municipal leaders across the province. What was reinforced to us was that the only one thing that can change those predicted numbers is you. You and your decisions are what will make the difference in the spread of this virus. And for some people, that is a difference between life and death. That is a sobering thought, I know. For the first time for many of us in our lifetime, we are faced with a responsibility that goes beyond oneself, beyond our families. Our responsibilities extend to the entire community. Here in Chestermere, we remain at 12 total cases, and I'm pleased that includes 3 cases that have recovered. But we are not out of the woods by any means. Our individual and collective actions will determine if Chestermere is able to contain the spread of this deadly virus, or if this virus takes a hold of us. As the modeling shows, someone who contracts COVID-19 may not show symptoms for many days, or as we are seeing, they may be asymptomatic. And an infected person has a chance of infecting many people. But the ways in which we can save lives are simple. Stay at home and inside. Only go out when you're feeling well and when it is absolutely necessary. Wash your hands frequently for at least 20 seconds. Cough or sneeze into a tissue or your sleeve and then wash your hands. Do not touch your face with unwashed hands. Stay at least 2 meters away from anyone who does not live in your household. Postpone or cancel any events, celebrations, or gatherings. One other thing that has stressed in the Premier's update and the modeling forecasts was that they are not expecting the peak of this disease until at least mid-May. That means that your decisions over the next few weeks are absolutely critical in what will happen. Here in Chestermere, we are continuing to explore further actions we can take to protect our community. Some have emailed me about so-called extreme or excessive measures to contain the virus. To you, I say we are in extreme times. This is clear. This is without contest. Countries and cities locking down is extreme. Closing borders is extreme. Closing national parks is extreme. Airlines not flying is extreme. People returning from vacation outside of Canada having to be quarantined at home for 2 weeks is extreme. 20,000 people in our country getting sick is extreme. 1.5 million people in the world getting sick is extreme. 1 million Canadians now out of work is extreme. Closing playgrounds, sports fields, arenas, schools, businesses, attractions, and so much more is extreme. This is absolutely nothing normal about this situation. It is indeed extreme. A few people are feeling hard done by because some of our measures are impacting their lifestyles. We recognize that while these measures impact the lives of our residents, the measures are part of a larger plan designed to keep us and the people we love from getting sick. And for these measures to be effective, we need everyone to think beyond themselves and consider their families, their friends, and their community. I and our council are confident that the measures taken by our emergency management agency, our professionals managing this emergency, and our director, Bernie Morton, who is also our CAO, are the right ones. We are lucky to have this team working hard for us every day out of the Emergency Command Center and working hand in hand with Alberta Health Services, Alberta Emergency Management, and other agencies. They are responding and helping our vulnerable citizens. They are responding to medical calls and putting in place measures to save us from getting sick. And we should thank them. We are doing everything we can to protect our community, and I trust that you too will do your part to take care of our community. Let's continue to stay home, save lives, and prevent the spread of COVID-19. Together, we can do it, Chestermere. Thank you and good night.